This is Dr. Roger Knapp, pediatrician. Let's talk about bedwetting. Not a fun subject, but it's very frequent. And you train your child, potty train them during the daytime when they're awake, but when you're sound asleep, you don't teach anybody anything. Bedwetting is how deep a sleep they go into. It has nothing to do with training. Restricting liquids won't help. If you get them up to keep them dry, then you're trained, not the child. And so I would recommend just waiting. Eventually they become dry at night when their sleep pattern changes as the brain matures and grows. But the statistics in first grade, 10% wet the bed every night. In middle school, 1 kid in every classroom. And close to 1% of adults, 20-year-olds, wet the bed. And just we don't mention it. Can you imagine going on your honeymoon with Depends? It's real romantic here. So it can continue quite a while, many kids into grade school. And if you praise a dry morning and then the next time they wet, then they feel bad about themselves because they must have done something wrong. So praising nor punishing in the mornings will not help because they didn't know what they did. It's like praising or punishing your husband for snoring. He was sound asleep, he didn't know what he did. It's not going to affect him snoring, nor the bedwetting. So in the morning, they occasionally are dry. Just be nonchalant. Hey, how's it going? They may say, hey, I was dry, and you say, cool. Just be cool. But if you overpraise them, then the next time they're wet, then they're feeling self-conscious or poor self-esteem. Make no big deal of this. Just keep them in pull-ups. But in the old days, we used to have to put the child in the tub and the sheets in the washer every morning, until teenage years even. So just use your pull-ups at night and make no big deal or mention about it. Now there is a medication in grade school years called DDAVP, and it's an antidiuretic. If you want to get rid of fluids, we take a diuretic to get rid of liquids. This is an antidiuretic. Been using it for 20 years, safe, okay to use. My recommendation though is to only give it with special events, like sleepovers, campouts with the Boy Scouts or whatever. Just use it when needed so they're not socially embarrassed. Doesn't work on everybody, but the majority of people. And so if you are in school age and having issues, give your pediatrician a call and we can help that out. But until then, just put the pull-ups on and wait. He's going to be dry someday. Thank you.